Hey guys, in this video we're getting ready to go through the palpation of the AC joint. During our palpation of the AC joint, we'll be doing an A to P palpation, a P to A palpation, S to I, and I to S. So as we go through and do our palpation for A to P is where we'll start. I want you to find the clavicle and then move from proximal to distal along that clavicle. Remember that last lab we said that clavicle jogs, so we need to make sure that we're palpating all along that clavicle and finding that AC joint. We're going to use a hypothenar contact again over that distal clavicle, and we'll still use a little bit of distraction. Make sure your patient's giving you a spaghetti noodle here with their arm. So what you will want to do is palpate that distal clavicle and add just a little bit of pressure A to P, and you should feel a little bit of a spring in that AC joint. The P to A palpation is identical to the SC joint. We're just very slightly moving laterally here. So I'm again going to pick that arm up, create a pocket behind the clavicle, use the contact behind that clavicle, and then lift as I'm applying pressure through the digital contact that I'm using as I establish that digital contact on that kind of superior posterior aspect of that clavicle. So we're sitting at about the mid-clavicular line, but we're kind of cheating towards the AC joint here. You'll never be able to palpate directly behind that AC joint without causing some discomfort for your patient. Okay? The next thing that we need to do is an I to S palpation. So when we do the I to S palpation, up to this point we have been moving the clavicle, but here I'm going to move the acromion process. So what I'm going to do is I'm going to block the clavicle. I'm using a hypothenar contact. I am blocking that distal clavicle. My outside hand, I'm palpating over that AC joint. You see that I've got my patient's arm between my knees here. What I'm going to do is provide a little bit of traction with my legs. When I apply that traction, I am pulling S to I through the GH joint. That interaction with the humerus and the glenoid fossa also pulls the scapula, which the acromion process is a projection of, down. So basically what I'm doing is I'm taking that AC joint, and if this is my clavicle, this is my acromion process, I am pulling that acromion process down, which is the same as me pushing the clavicle up. Okay, the reason we do this is because it's extremely painful to dig into that shoulder and press straight I to S. Okay, the last palpation is an S to I palpation. So here we're going to use a digital contact. We're going to borrow our patient's arm and bring it out here to the side and cradle it. Find that AC joint, so use the clavicle, work all the way out laterally, and then use a digital contact here to challenge straight S to I. So I am shooting down towards her feet here. I'm applying pressure straight down towards her feet, and I should feel a nice spring here. This was the AC joint palpation. All right, this is an alternate A to P and P to A palpation of that AC joint. So if I'm going to do this alternate palpation, I'm going to have my patient seated here, and I'm going to use a digital contact when I do this. So what you're going to do is you're going to palpate along the course of that clavicle, move distally along that clavicle until you land on that AC joint. What I want you to do then is to take your thumb and place your thumb on the spine of the scapula. This basically takes that scapula and it locks it in place. Then I want you to take your digital contact, lay it over the top of that clavicle, and then you're going to squeeze, just apply just a little bit of pressure. You're basically doing this. You're kind of squeezing squeezing the scapula and that clavicle together. Make sure that you're spreading your contact out quite a bit here on that clavicle. We don't want to cause our patient pain as we go through and do this palpation. But we're squeezing, kind of like a handlebar brake on a bicycle. So you're squeezing here, adding that little bit of a compression. This would be an A to P palp. The P to A palpation here then, I'm going to use a digital contact again. I'm going to still stabilize with my thumb on the spine of the scapula, but I'm going to find that clavicle, use that digital contact, and basically I'm going to use this kind of an oblique angle. I can't get directly behind the clavicle because I'd have to dig through scalenes and the trapezius, etc. to get there. But I can find the superior aspect and even the superior posterior aspect of that distal clavicle. So what I'm going to do is find that contact, spread my contact out here, my digital contact, over 2 or 3 fingers. And then I'm going to use that and press. Basically this oblique angle here. So this is a P to A with a slight S to I component as we're palpating this clavicle. And we should feel a nice spring as we're applying pressure there and pushing that clavicle. This is the palpation of the AC joint.